everyone. You're welcome to Achievers Nclex-Rn Consult. This is Next Max, and in this session, we'll be looking at ventilator alarms and all the key Nclex-Rn points on this subject. Let's get rolling. Before we delve into the main subject of the ventilator alarm, let's take a look at this image of a man who has been placed on this machine. So this machine is a ventilator. What then is the function of a ventilator? A ventilator is designed to deliver air into the lungs of a person under positive pressure. So we can also say that it takes control of their breathing when they cannot initiate spontaneous breathing on their own. As is designed to deliver oxygen into the lungs, it also has a function of taking out carbon dioxide. So that is the function of a ventilator. Now let us delve into the two key alarms to know for the Nclex-Rn exam. The two key alarms to know for the Nclex-Rn exam are the high pressure alarm and the low pressure alarm. So the first one that we should know is a high pressure alarm, and the second type of the alarm that we have to know for our Nclex-Rn is a low pressure alarm. So for the high pressure alarm and the low pressure alarm, we use the mnemonic hold. And with this mnemonic hold, the first two letters goes together and the last two letters goes together. So let's delve into it a little and break down our mnemonic hold. What does the mnemonic hold stand for? The H stands for the high pressure alarm, and for the high pressure alarm, as we said, the H always go with the O. So the O means obstruction. So it means that when a high pressure alarm sound, the cause of the alarm is as a result of an obstruction. So let's consider our two last letters. So the L stands for the low pressure alarm. So for a low pressure alarm, we think of disconnection. So D for disconnection. So when a low pressure alarm sounds, it means that there is a disconnection. So this mnemonic would help us to know why a specific type of the pressure alarm, being the high pressure alarm or the low pressure alarm, will sound. But for the purpose of bots, or for the purpose of Nclex, we have to know the various factors or the key points under each, either obstruction or disconnection. So let's now consider the causes of the high pressure alarm. We've already established the fact that the high pressure alarm, which is the O, is as a result of an obstruction. So we want to consider some factors that can lead to obstruction. So we are looking at the high pressure alarm. So the first point that we consider is when a patient bites the tube. So let's consider this to be our patient. This is a rough sketch. And the trachea tube is placed inside and it goes straight into the trachea. So let's say that this is the lungs or the airway of the patient. So this is one lung and the other lung comes here, Assuming that this is our trachea and we've inserted the endotracheal tube here, and this endotracheal tube is then connected to the ventilator. In situation where the patient bites on the endotracheal tube, it's going to cause an obstruction, and the high pressure alarm is going to sound when the patient bites on the endotracheal tube. It's going to cause an obstruction. The second point under the high pressure alarm that can cause an obstruction is bronchospasm. When there is bronchospasm in the airway, it can cause an obstruction. The third point that we want to add is when there is an increased secretion. When there's too much secretion, an increased secretion, or when there is thick secretion, it can block the tube. Once it blocks the tube, it's going to cause an obstruction. The fourth point that we want to consider under the high pressure alarm is when the patient coughs. So coughing can be a cause of why the high pressure alarm would sound. The fifth point is when we have kink in the tubing. When there are kinks in the tubing, it can also trigger the high pressure alarm to sound. Or another factor that is worth considering is when we have condensed water in the ventilator circuit. When there is condensed water in the ventilator circuit, it can trigger the high pressure alarm to sound. So these are some factors that can trigger the high pressure alarm to sound, and it's very important that we get to know these factors. But in general, we are saying that the high pressure alarm is triggered by an obstruction. So the obstruction can be bronchospasm, it can be kinks in the tubing, it can be an increased secretion, it can be condensation of water in the ventilator circuit, or it can even be an endotracheal tube occlusion, when there is an occlusion in the endotracheal tube, or when the patient coughs, as we've said earlier, or when the patient bites the tube. These factors can all contribute to obstruction, which will trigger the high pressure alarm to sound. So now let's look at some factors that can trigger the low pressure alarm to sound. So let's go back to our mnemonic hold. So for the low pressure alarm to sound, there should be disconnection. Let's look at the specifics. So for our low pressure alarm to sound, these are some specific points that is worth knowing. So we are looking at the low pressure alarm, and we think of disconnection. So one of the first factor that we consider is when there is a displacement of the endotracheal tube. Or when there is extubation. So earlier we said that an endotracheal tube is passed, is inserted, and it enters into the trachea and is then connected to the ventilator. So if there is a displacement or if there is extubation, the low pressure alarm can be triggered to sound. The second factor or point that we will say is when there is a leak. So when there is a leak in the circuit, in the ventilator circuit, it can cause the low pressure alarm to sound. The third point that we will consider is when we have a carved endotracheal tube, which is deflated. So when we have a carved ET tube which becomes deflated, so when this happens, the low pressure alarm can sound. The next point that we want to consider is when there is loose connection. So when there is a loose connection, the low pressure alarm can be triggered to sound. So these are the factors to consider under the low pressure alarm. So for the high pressure alarm, we said we should think of an obstruction, but for the low pressure alarm, we think of disconnection. So our whole mnemonic would help us to recall the factors under the high pressure alarm and the low pressure alarm. The last point to add up is that for these ventilator alarms, when either of the two sounds, we say that patients before machine, patients before machine. So what does this mean? This means that when either of the two alarm sounds, we give priority to the patient. We want to attend to the patient. We want to make sure that the patient is doing okay. We want to do our assessment to know the state of the patient before we check on the machine. So we always say that P before M, as patient before machine. So this brings us to the end of ventilator alarms. So in summary, we said that we use the mnemonic hold. And for the hold, the H goes with the O and the L goes with the D. So the H for a high pressure alarm, which indicates that there is an obstruction, and L for low pressure alarm, which indicates that there is disconnection. Okay, so now let's try our hands on some Nclex styled questions on ventilator alarms. Good luck.
Also, I know you had most of the questions correct. This brings us to the end of ventilator alarms. This is Ness Maxwell from Achievers Nclex-Rn Consult. Please kindly subscribe to this channel for more videos. If you are studying for the Nclex exam, I want to encourage you that you can make it. Have a great day.